Good morning. Welcome to the Inside Podcast in Focus. Today I'm with Chris Watney from IFHP. Welcome, Chris.
Oh, thank you very much indeed. Nice to be here.
Great to meet you. I know we've spoken for a little while, but good to finally meet you in person.
Agreed. Yeah.
How's the travel?
Yeah, fine. It's a quick trip today, unfortunately, but hopefully next time I can spend a bit longer in Cape Town.
No, that'd be great. That'd be great. So I know you, I guess, not super well, but reasonably well enough. Is just maybe tell us a little bit about yourself. Our audience is quite new to IFHP and sort of where you're from.
Yeah, of course. Well, I'm an Englishman by birth. I spent a lot of time in New Zealand, and when I was in New Zealand, I finished up in working for Southern Cross, which is the biggest health insurance fund in the country. I was the chief marketing officer there. There I was introduced to an organization called the International Federation of Health Plans, the IFHP, and that was the company I left Southern Cross to come back to London and become the CEO. And I did that in 2020. In fact, my first day in the job was April the 1st, 2020, which was 4 days into the lockdown for COVID. So it was an interesting time to take on an organization like that.
Jeez.
But the organization itself is a network. We're about 90 health insurance funds, plans, TPAs, HMOs, some associations as well around the world. And our members operate in about 40 different countries around the world. But the one thing we have in common is we're all private payers into health systems. And of course, therefore, all around the world, we suffer from all of the similar kind of challenges, but also opportunities. And what we try and do in IFHP is reveal some of those opportunities and challenges, distribute best practice where we find it, allow our members to network and discuss their experience on working some of these topics. And it's very successful. We've been doing it for more than 50 years. Maybe we haven't quite fixed all of those challenges yet, but we're working on it.
That's a great segue. Your talk today was about going from payers to partners. Can you maybe just give us a quick summary what your talk was about?
Yeah, of course. So the talk today really was about how health insurance funds, plans, companies around the world are taking more of a transformational role in their own health systems. And we've been seeing this now for many years in some ways. But in the last few years, I think there's been some very interesting steps forward. I think that the challenge that a lot of health insurance companies have is that on one hand, where public systems are failing, particularly after the pandemic, they're being expected to pick up some of that slack. They're being expected to pick up some of the demand that is there for health amongst the populations. But the problem is the systems that they then face into that actually deliver a lot of that health and healthcare aren't working. And so what we're finding is a lot of our members are taking sort of matters into their hands, if you like, and they're starting to do some really interesting things more in the provision space. So we have members of ours that are opening up hospitals and going into clinics and these sorts of things. But also in more interesting ways of contracting for services, really focusing on outcomes rather than just paying fee for service, paying for volume. Lots of this happening around the world, and I was invited to come and speak about some of that today.
Okay. You gave some really interesting examples around the world. I think one of the examples that stuck to my mind is just the example you shared on C-sections, about how effectively you went from
Yes.
1 in 9 roughly being an NVD,
Yeah.
and then switching it. What was the key thing they did to change that?
It's a very straightforward one. It's a nice simple one. There. So parts of Spain, they were finding that the ratio of C-sections to normal births were about 8-1, 9-1. So a huge swing towards having C-sections, elective C-sections. Of course, that's a big problem in Spain. In those areas, it should have been sort of 1 in 4, not 9 in 10. So what they did was very straightforward. They wanted to normalize that number. There was no reason why that number should be any bigger for the populations that they're talking about, and so they simply put in a series of incentives that helped the healthcare practitioners to modify some behaviors. And those incentives brought that right down to pretty much normal rates as you'd expect in any kind of population. Simple payment against a very simple outcome, and easily achieved in the end.
Yes, I think just given where our systems are, I know you've got a number of members in South Africa, you've got some in Nigeria, Zimbabwe, and so on. I think, just from your perspective, what are the key things some of the funders in those markets should maybe look at changing just to start on this journey? It's difficult to get to the end, but what's a good place to start?
Well, yeah. So I think the first thing to acknowledge is that already there is some extremely competent, very high quality, providers in terms of on the health insurance side, of course, but also on the provision side. So you're not starting from nothing. But what is happening is with the implementation of the NHI bill, then this is a time to pause and to think about what things are going to look like going forward. And I know that is happening now. This conference is part of that, but that's a thing that's happening more generally within the country. What I think the opportunity you have is really to take some of the international learning, see how some health systems around the world have organized themselves faced with similar kind of problems, but also a similar opportunity, and see what learnings can be taken. Now, I mentioned Colombia. Colombia is a very interesting case study because since the mid-90s, they've been working on exactly this basis, where the government actually is a commissioner of healthcare, if you like, of course, but actually it's this tight model I talked about. They have tight expectations on what healthcare looks like, and they've achieved 99.6% of coverage there. How the industry goes about doing it, that's loose. That's up to the industry to organize themselves. But then, of course, the measurement and evaluation at the end is also tight. And so we know what these numbers are. They can publish the data. They can publish the findings that they've got. Now, I know that Colombia itself is going through some political reform at the moment, and that is all up in the air right now. But up to this point, achieving 99.6% coverage is a phenomenal achievement. And that's down to, I think, largely through the health insurers being involved in the administration of that system. So what they were able to do was to create the system that worked, given the resources they had and the funding they had. And I think the results speak for themselves.
I mean, Chris, unfortunately, just the time you had 30 minutes to draw from examples around the world. Let's say, for example, there are people in the audience, funders. How do they get access to the kind of insights you shared? Just tell us a little bit about IFHP.
Yeah.
How do they join as members? What resources are available?
Oh, yeah.
I think that's quite beneficial.
Absolutely, and we've seen a growth in membership across across Africa actually over the last few years, which has been very pleasing to see. We're always welcome new members, of course. They can talk with me about that, and we have rates. We never want the cost to be prohibitive, particularly not in continents like Africa and countries like South Africa, Zimbabwe, and so on and so forth. So we can always have a conversation about how to get people involved. Once you're involved, you're part of this network, and you can be as much as part of that as you want. We run meetings all the time across a whole range of different topics that our members get involved in and are sharing best practice and case studies and things I talked about earlier. We have our meetings that we run. We'll soon be off to our CEO forum in Singapore. Next year we'll have our biennial conference in London. Lots of opportunity to meet and to share experiences and so on. We're just about to start applying some funds and some grants to help members, perhaps from Africa and other developing nations or parts of the world, to participate in the programs. So to get on our executive programs, to be able to travel the world and kind of see what's going on. I think it's a wonderful opportunity.
No, that's amazing. That's amazing. Because I know it was a lot of effort for you to get here, but thanks. We really appreciated that.
No, it was very easy, and I was very, very pleased to be invited, and glad in some small way, hopefully, made a little contribution.
So this year, IFHP is rolling again. Big Ideas Africa.
Yes.
Can you tell us a little bit about it, when it's happening?
Absolutely. So I think this is our 4th year. I think we've done Big Ideas Africa. We are always so pleased to do it. It's such a fantastic event that we can do within South Africa, but of course for kind of the near African countries. It's a time where we can bring in some sort of thinking from around the world, really sort of nestle that into what we see happening within South Africa and other countries, and try and get some great thinking, great ideas going as a result.
2 questions. When is it happening? Who should attend?
Well, it's happening in October. And who should attend? I think anybody that's interested in the future of healthcare. We tend to have some CEOs come along, executives, of course, but that doesn't matter. I think it's anyone who's actually wants to be part of that conversation.
Okay. And for the attendees, what's the biggest thing they'll get out of it? What's the value add to them?
I think they'll get a couple of things. One is they'll find learn some insights, learn some new things from what's happening around the world that we can kind of bring in from our global network. But I think also they'll have the opportunity to talk with other peers and colleagues within the industry to sort of surface maybe some new ideas, new thinking about the big challenges that are endemic here within the health system.
No, thank you very much.
Thank you.